Located in the picturesque Santa Cruz Mountains is the Western Institute for Group and Family Therapy, a 70-acre retreat and training facility and home of Bob and Mary Goulding. Bob, a psychiatrist, and Mary, a social worker, started the Western Institute in 1969. They have combined transactional analysis and Gestalt techniques into their powerful and unique approach called Redecision therapy. You will see them work with 7 clients and then discuss their theory and interventions with Ellen Bader. Ellen is a psychologist in private practice in Palo Alto, California, a faculty member of the Western Institute, and past president of ITAA. In the following pieces of work, you will learn the hows and whys of Redecision therapy.
First of all, Bob and Mary, I'd like to begin by thanking you for being willing to do this and to donate your time to ITAA the way you've done is really something special.
You're welcome.
It's been a lot of fun so far.
Well, I think this interview should be a lot of fun, too.
Yeah.
I also think it's brave because I know you've worked in front of lots of therapists for years, but this is an opportunity for therapists to really slow down the tape and use it for training and scrutinize your work and look at it in more detail. And so I appreciate your guts, too.
It's fun. Still fun.
Okay. And Mary, I'd like to start by asking you if you would just tell us something in general about redecision therapy.
Sure. Redecision therapy is a word we decided on, and we considered it a mix of Gestalt principles, and particularly Gestalt methods, and transactional analysis theory, in which we use the theory of Eric Berne, especially the theory of injunctions and decisions, and use the techniques of Gestalt to get people into their, what we call the free child ego state, in order to make new decisions, in order to take off the straitjackets that they've put on themselves in the past, so that they learn, so that in one scene they think differently, feel differently, and behave differently from the ways they had permitted themselves. And all of this is in terms of what the client wants. So it's contractual therapy.
And based around what the client decides they want to do.
Right.
Okay.
You bet.
Bob, when you go into working with a client, do you have a thinking structure already in your head, or is a lot of what you do in the room intuitive and based on theory that you knew beforehand?
Well, it's both, of course. I have a thinking plan that I have very carefully drawn out myself over the years of what I intend to accomplish. And then a lot of the work that I do in accomplishing it is often intuitive. It's often keyed into memory, all kinds of past experiences that I use, so often not even realizing that I'm using a past experience. But the thinking process is one that I think is very important. And so what I've done is draw it on the good old TA white sheets here to go over very carefully with you.
Will you do it?
Sure. In the first place, Ellen, the most important issue is that in order to get a redecision, the patient has to be beginning to recognize and feel his own autonomy. That all patients in some way are victims until they do the work they have to do to get out of the victim position. And so I think of them as victims when they start. They'll do all kinds of things to re-emphasize their victiming. And our job is to get them to recognize over and over again that they're in charge. They're in charge of their feelings, their thinking, their behavior, and their body in some way. And so that's my general framework. Now, how to get there? In the first place, there has to be a good contact between the patient and the therapist of some kind. So we do lots of things to get a contact going, both in the work that we do before the therapy itself ever starts, and in the way in which we meet people when they come into our house, when we write to them, when we spend the whole week, 2 weeks, 4 weeks with them, eating with them, swimming with them, playing with them, is all contact that increases and greatly enhances the kinds of things that we do. Then when we start working, the contract is specific. You know, Berne taught us how important contracts were for change. That if each person is facilitated his stating his contract in a way which is clear, which is measurable, which is in a finite distance of time, then the work becomes easier and easier. If I know clearly that somebody wants to stop being anxious about talking, then I have a clear idea that when he starts talking with fun in front of a group, he's gotten the contract. What's very important to pick up in terms of the autonomy is the way in which he cons himself and theoretically the therapist, although of course the therapist never is really conned, he's only conning himself. So people say lots of things like what I want to work on, and we'll see that in this film several times, or what I want to try to do is. And I want to always hear the first con because that's the most important one to pick up. If they get that past us, it's harder and harder and harder to pick up the clear autonomous words. Then I want to listen for what the chronic bad feelings are, what Byrne called the rackets. I want to find out what the chronic bad thinking is, the obsessive thinking, for instance. What some of the chronic bad behavior is.
When you say bad, you mean not self-enhancing.
That's right.
You don't mean naughty.
No, I don't mean naughty at all. I mean the things that they use that keep them in the victim position. Mm-hmm. And they think like people make them feel badly, for instance, and that's victiming. So the chronic bad feelings, thinkings, behavior, and often body. There are a lot of things that we treat psychosomatically, which are part of chronic bad body. Now, the way in which people support their chronic bad feelings, thinking, behavior, and body is by the games they play, the fantasies they have, or their belief systems. And there are probably other ways, but the three main ways that we look for are those three. The fantasies about the future or about the past. The belief systems, like the very famous one, don't feel too good or something bad will happen. It's a very common belief system. Most of those different ways of maintaining bad feelings and feeling badly come from our early childhood decisions, the decisions which we made long, long ago, which we get stuck with in terms of the stroke patterns of the family and the kinds of messages that we get from parents, the message from the parent of the parent, the child of the parent, which we call counterjunctions and injunctions. A lot of the stroke patterns are important. What people do in the family keeps supporting the kinds of things that they're looking to change. What's the general script that this person has in terms of their life unfolding? So those things I think about in terms of the pathology, the changes that have to be made. And then on the other paper I have listed the kinds of things that we do at that point. One is resolving the impasse, and of course looking for the kind of impasse, the type 1, type 2, or type 3 impasse. The resolution. Now, of course, the main resolution that we're looking for is a redecision. So this early childhood decision is changed by the patient. Also, we do a lot of acoustic decontamination. We get people to recognize what's belief system and what's fantasy and what's reality. We do a lot of work with reconstruction of ego states. We do self-reparenting when we facilitate the patient developing a new parent for himself, which is different than the old parent that he had. So after that kind of work of resolving the impasse, then we are going to, every time that we can, go do an anchor in which we help the patient to fix this in his memory so that he goes back to this scene of resolution rather than the old scene of destruction and of impasse. We want to help him make an adult plan for himself in which he designs what he's going to do differently, how he's going to think differently, feel differently, what he's going to do differently about his body in the future. We like to do that at a different time than the time we do the anchoring, so they have a chance to separate out and to enjoy the stroking that they get from the victory itself. And of course with that, there's also a change in the stroke patterns, and we want to design that. So even in the therapy itself, there's recognition of change and ignoring non-change and staying in a victim position. Brag time.
I feel very good today about the work that I did yesterday. This morning I was able to wake up with no nightmares and to just run down and jog and come back and just jump up and down. I felt free today.
Wonderful, wonderful.
Great.
Some of them weren't with you. You want to say in a sentence or two what you did?
Yes, yesterday what I did is I said goodbye to my father. He died last year.
Good.
Lovely.
Yeah. Who else got a brag?
Yeah, I'll go. Radio.
Joanna?
I feel really good this morning also, and it was as a result of work that I did yesterday where I said goodbye to my sister, who'd been dead for a long, long time. And I've been singing ever since.
How wonderful. All right. All right.
I feel good today about being here right now, despite the fact that I feel real scared.
Yeah, my brag is that I allowed myself to experience learning from yesterday's therapy experience, from sitting in the chair, being the therapist.
So this is the third morning of a 5-day workshop, and you all have done a lot already.
So who's on?
I am.
What do you want to change?
Is it okay to say your first name?
It's okay with me.
Go.
I'm Anne, and I would like to change the feeling that I get before I begin anything new.
And do you have that feeling right now? Because your voice is a little choked.
The feeling usually starts here, but right now it's there.
Yeah.
It's right here.
Sort of like your finger a little while ago when you were bragging that you were being different about learning.
I usually wake up in the morning before I go to work, as I did this morning, feeling with a feeling of a tightness or a knot in my stomach.
And while you're doing that, you've been doing this with your foot. Experiment with doing that some more and seeing what you do with it. What do you experience? You got a smile now, along with the tapping.
I could see my father sitting there doing
Okay,
this.
be your father right now, just tapping away. And just, don't stop, your gestures are wonderful. Yeah, what's his message?
Can't do anything right.
Okay, now see if you can figure out something else to do with your foot to get rid of that message.
All right. Answering back with words besides the foot. He says you can't do anything right.
Yes, I can.
Say some more.
As a matter of fact, I can do a lot of things right.
Say some more.
I can do things that you can't do.
For instance.
For instance, I can work with people in a way that you have never been able to work with me.
I noticed that you started looking up at him, and now you're looking down at him. Is that a change in your position in regards to him?
Possibly.
So say some more to him.
And be specific how you work with people that he doesn't.
You've always judged other people, and I assist people away from judging themselves and judging other people.
Including me.
Including me.
Yeah.
What do you experience?
My heart is throbbing in the back of my neck, if that's possible. Feeling
No, it isn't, but you might experience it that way. And let your throbbing talk to you.
Are you sure this is okay? Is it okay to talk to your father like this?
Yeah.
And have you an answer?
Sure, it's okay. You're no longer a little girl. You don't have to listen.
Would you try,
Yes.
would you experiment with saying, I'm no longer a little girl?
Okay.
Rather than you're.
I'm no longer a little girl.
Yeah,
As
yeah.
a matter of fact, I'm an adult woman.
Yeah.
Intelligent adult woman. Very capable and competent.
Mm-hmm.
Let's get a
That's
chair.
okay.
Yeah, that's fine. Just, oops. So, there's Dad, huh? And sit here and beat him for a moment. What's your name, Dad?
Mike,
Okay, Mike. What'd you do for a living?
I was a blue-collar worker.
Meaning?
I worked for the city. I did work for the water department. I was a supervisor.
Oh, good job.
Not bad.
Did you think you had a good job?
No,
How come?
because I never made enough money to support my family.
Is that true? Or did they always want a little more than you brought home?
They always wanted more. They never said a lot, but I always felt like they needed more.
Uh-huh. So you'd never got yourself to feeling successful.
That's right.
That's rough. And as the kids grow up, what are you thinking of their successes?
I want them to have a better life than me.
I bet you do. You a little jealous, too?
Not of my son. I want him to be better.
Uh-huh. There's a big difference between girls and boys, huh? What do you think about her?
Well, she was the baby of the family. I like her a lot. Love her a lot. She started changing when she got older.
What age did she start changing?
About 13, 12.
Okay, so she was really neat before she got to be 12. Yeah. If only she could have stayed 11, 10, 9. I'll bet you she was even nicer at 3.
Yeah, she was real cute.
I'll bet you really enjoyed her at 3. Yeah. So do you. So you're waiting for him to approve when what he likes is a 3-year-old.
What are you experiencing? What are you thinking?
The ridiculousness of this.
Of what?